All right, so we'll start. So today we have these two youngsters, Shruthi and Charan, and very, very experienced. And the other day I bumped into Shruthi and she said that she is an organizational psychologist, and my ears and my eyes popped up and I was like, oh wow, this is just the person we were looking for. So, and then while chatting, we also got to know about Sharon, who is doing excellent work in clinical psychology, a very sincere student and doing a lot of good work. So we are very glad to have both of you. So you can start, and maybe after you both take your session, we can open it up for question answers. That's okay, right? So half an hour later, we can probably open it for question answers.
Definitely.
Okay, Sharon, is that okay?
Yes, perfect.
All right. Okay. Over to you, Shruthi.
Yes, thank you so much for this beautiful introduction, Seema. It's a pleasure for us to be like a different kind of audience that we have here today. It's nice to see a lot of you are interested in psychology and also have taken it as as a career option for you and looking at a change in your career also, or probably merging it with whatever that you're actually doing currently, right? So today, yes, as Seema rightly mentioned, I'm an organizational psychologist. I have been working for the last 1.5 years in MSME here in Bangalore. And okay, yes.
Yeah, please put yourselves on mute, everybody, except for Charan and Shruthi.
And yes, I also have my friend here, Charan, who's currently doing his Master of Philosophy, his MPhil in clinical psychology in NIPMed. And we both have done our post-graduation together. And like, I know he's one of the go-to candidates in clinical psychology. So that's one of the reasons why both of us are here today to share a few insights on the different career prospects in both the different fields, that is OB as well as in clinical psychology. So we'll start off with OB. If you have any questions, then we can, have it at the end of the session. And yes, so starting off with organizational behavior. So I'm assuming that all of you will kind of be aware of what exactly an organizational psychologist or an industrial psychologist would do as a, in the day-to-day work. So here we're coming to, with respect to the educational requirements, you basically require a master's degree in psychology. Even if you had done an undergrad in psychology, that is also well and good, or even if you are directly pursuing your master's, even that is more than sufficient for becoming an organizational psychologist, with a specialization probably in the second year in human resources management and OB. Coming to the job prospects of it. So I'll give you a very, very realistic picture of what exactly is seen most of the majority of the companies in India. Yeah. So here we work along with the human resources department. So there are very, very limited companies which have a separate department for the organizational psychologist here in India currently. Okay, you do have a broader scope when you go abroad or out of India. Yeah, but in India, so when it comes to human resources management, so there is an integration of both the management, the business part of it, as well as the psychology part of it. If you would like to, focus more into psychology, there are areas which you specifically choose, in terms of your work. Okay. So I have started, in the area of human resources management. I initially started with almost getting to explore the different functions of HR, right? So human resources department has close to 10 functions, which goes behind and which probably the employees might or might not be really aware of. It's not just the usual perception of recruitment, hiring and firing. There's a lot more to do. There's a complete employee life cycle that is managed by the human resources department, right? So how do a psychologist or an organizational psychologist add value to it, and what is going to be your major area of focus here is, I would say, it is very, very company centric and also job centric. So as I said, human resources has almost close to 10 functions, right? The kind of functions that you are going to handle, the kind of job roles that you are going to handle there is going to define your role as an organizational psychologist. For example, I will give you an instance where most of the organizational psychologists are people who come with along with a psychology background. They will most probably be choosing functions in the area of learning and development, or in the area of employee experience and engagement management, and then also employee well-being. So these are the things where there's a lot of psychological principles, and you'll be applying your theories that you'll be learning in your masters, right? And also there's another area which most of the OB psychologists focus on is into the organizational development part, area domain. So you might have come across a lot of OD consultants. Probably we might have a few here also in this group. I'm not very sure about it. Yeah. So OD again is another area which usually OB psychologists specialize in. So this is more to do with how do you make process the right from the process till from the end of business impact of it more employee friendly, right? So you as an OB psychologist, you would be more like a liaison between the employees as well as the management. So for you, but your more focus will be towards very employee centric focus, right? Right from designing policies, what is very best suitable, or what will your employees really like, or what is matching with their motives, what is matching with their needs, is something that a psychologist would be a better person to probably put forth the suggestions or take up those decisions rather than somebody from a business management background. So that is a very critical role that a psychologist will play there. And another area is, as I mentioned, employee well-being. So this again is kind of very focused on the employee health, both the physical health and the mental health. Definitely, there's a lot of pressure. There's a very pressure that is not spoken about in workplaces, and people might be going through their own emotions. So addressing these emotional needs is another area which also organizational psychologists will focus on. We might not be, very specialized in theory, the therapeutic part of it. You might have to take up a different certification if you have to get into employee counseling or, related aspects. But again, the kind of employee connect or the kind of employee experience that you're going to deliver for them is again decided by the organizational psychologist. Okay, and we also have different other roles, which is now, kind of getting scope in the Indian markets. One is with respect to, I think most of you might have come across at least one corporate trainer in your experience that you've had. So corporate training is again one very, very, I would say, very fancy job. They get paid really well these days, especially if you are looking at the companies and corporates are looking out for some very niche skills in the market. Then I think you can definitely specialize in those areas, and you can just mint money over there. So that has always been a trend, but I wouldn't recommend, if somebody is really interested in training and teaching people and coaching and mentoring them. Yes, definitely you can try out that particular space. But otherwise, as a psychologist, if you're very passionate about this particular subject, then I think employee experience, engagement, learning and development is also one area that you can definitely focus on. Yeah. And I think a few other new roles which are coming is in terms of marketing psychologist. And also, I think even when I was discussing with Charan the other day, he mentioned about UX researchers. So I think these are some of the very niche areas that OB people also tend to take up. Okay, especially if you are doing your master's in OB, you will definitely have a paper related to marketing psychology, and you can definitely, if you're very interested in that particular domain, you can explore that space as well. Yeah. And any other role apart from if you don't want to practice in a corporate as an OB psychologist, then you always have teaching as another major area where you can get into. And also as a researcher, you can also be part of any of these corporates. Compared to coming to the last part of it, the monetary aspects of it, definitely yes, you will, if you're going to enter into a corporate, which is going to be a major area of work, or where usually people, you can see OB psychologists in these particular areas. Yes, definitely you will definitely see a good career growth, in probably next initial 5-6 years, the growth will be pretty faster as compared to a clinical or a counseling psychologist. So I think this is pretty much about OB. So I would be happy to take up the questions later once Charan finishes about clinical. Yeah. So over to Charan.
Thank you so much, Shruthi. And hello all again. And here I'm going to talk about what are the scopes and opportunities that is coming in the line of clinical. So clinical as in clinical psychology and also the allied domains as well. So clinical, when we get into the area of the clinical domain, there are two areas. Firstly, clinical practice and clinical research. So first, I'll just give a brief overview on what is clinical practice and what are the related disciplines and allied disciplines that people could take up and practice in the area of clinical psychology. And then later I'll go to what is clinical research and stuff. So clinical practice in India. So it's basically for you to do your clinical practice after your psychology post-graduation. As you would many know, you have to do your MPhil program. So MPhil program is not just any other MPhil program that was used to that was many people would take up back in those days, and presently also. Presently, I hope that you would aware about the fact that MPhil has been removed from the UGC syllabus and coursework. So this particular MPhil program, that is MPhil in clinical psychology in itself, it's a residency program. It's not a research program, whereas the conventional MPhil programs were targeting people who wanted to get into research and academia as such. Okay, so this program would be a residency program, and it would have 2 years of training on the areas of pediatric psychiatry, community psychiatry, geriatric psychiatry, sometimes neurology also, and neuropsychiatry and other allied disciplines. So during these 2 years, you would be sent for a rotary posting in all these domains, and when you come out of it, you would become a fully fledged clinical professional who can able to handle clients or patients who are having problems in their emotions, behaviors, or any other psychological problems. So what you'd be doing, what is the scope of this particular, or what is the role of clinical psychologist in India? Okay, so clinical psychologists are trained professionals who could able to diagnose and treat mental disorders and any other psychological disorders. So that's the role of clinical psychologist, and that's the job role that you would be taking up. So adding to it, what are the allied disciplines and what are the other courses, or what are the other courses that you can take up in order to be in clinical practice? So traditionally people would go for MPhil because it's just 2 years of clinical training, but there is, in addition to that, there's another program which almost lasts between 4 and 5 years. So that's called PsyD, or Doctor of Psychology in Clinical Psychology program. So that would rigorously train the individual in terms of only clinical practice. But what is the distinction between these two courses are MPhil and PsyD? When you do an MPhil, you can do your clinical practice as well as you can get into the area of academics as well. You can teach people in the related disciplines as well. So let's say there are many other national institutes that has been laid up all across India. So if you have done your MPhil in clinical psychology, you would be considered eligible to practice as a clinical psychologist or a consultant clinical psychologist in such institutions or hospitals. Adding to that, you would be considered eligible to practice as a, not practice, to work as an assistant professor or associate professor based on your experience and skill. So this is what the primary distinction. But in PsyD programs, you could be only able to practice as a consultant clinical psychologist. You won't be able to practice or work as a professor or a lecturer and so on. All these teaching related positions, they cannot able to they won't be recognized, or they won't be given these roles. They would be here the scope would be only with clinical practice only. Though you can work in such national and other reputed institutions, you won't be able to teach people in those areas. So adding to this, there are again similar courses or diplomas or degrees which you can take up to be in the to work in the area of clinical psychology as well. Or let's not say clinical psychology, to work in the area of uh, to work with clinical population. Let's keep it like that, to work with clinical population. So one such course is something called as RCI has rolled out this course very off late. Okay, it's called PDCP, that is Professional Diploma in Clinical Psychology, which is a 1-year training, residential training course, especially for designed for people who don't have that much time. Let's say for the traditional MPhil would take you 2 years, and the PsyD programs would take you 4 years to graduate. So people with such time constraints and limitations can make use of such programs. So what is the difference between, now let's talk about what is the difference between people who have PDCP, who have done their professional diploma in clinical psychology, and MPhil. Okay, so PDCP is, as I said, it's a 1-year program which focuses on all these areas, which I said earlier. That is pediatric psychiatry or child and adolescent psychiatry, and psychiatry with normal population, that is above 18, and geriatric psychiatry that deals with patients who are above 60, and community psychiatry, neurology, and other general medicine branches also. So the trainees would get an hands-on experience across these allied areas, so that once they graduate, they can be able to also diagnose and work as much in par with clinical psychologists. But the catch here is persons with PDCP are called associate clinical psychologists, whereas persons with MPhil or PsyD in clinical psychology would be called as a clinical psychologist. So what's the difference here is, associate is someone who has a rank which is considered a level below than a clinical psychologist. So mostly in government institutions, they would maintain these ranks. So when we look into the recruitment and other stuffs in terms of clinical psychology and clinical psychology related posts, associate clinical psychologist would hold a cadre that comes under group B, whereas the clinical psychologist would hold a job which has a cadre of group A. It's more like there is this UPSC service commission exams, right? You have a group A, group B, group C exam. So it's more like the rank is like that. So this is the distinction between what is a PDCP course and what is the MPhil course. But in terms of training, it would be it would be one and the same, but the duration of the training would vary. PDCP would be 1 year, and the MPhil programs would be 2 years. And adding to this, there is also another course which also gives you an opportunity to work with the clinical population, that is PDRP, it's Professional Diploma in Rehabilitation Psychology. So Professional Diploma in Rehabilitation Psychology, over here, it's not if you look at the job roles of PDCP and PDRP, it won't be the same, but you would be again working with clinical population. So the catch here is, if you have a PDRP, if you have done your PDRP course, you would be considered as an associate rehabilitational psychologist, and your day-to-day job would somewhat look like disability rehabilitation. So persons with disability, again, they are considered as a clinical population. So you would be engaging in methods and ways that would help them, that would bring in rehabilitation programs in them. So you would also engage in doing therapies, and also you would engage in doing assessments. This is when we say MPhil clinical psychologists, people who have done MPhil clinical psychologists, they would also engage in assessment and stuff. And again, that is common with rehabilitational psychology also. But here the main focus is, you would be helping in the areas of disability management and disability rehabilitation. That's the primary distinction. Also, PDRP has a higher degree, that is a MPhil in rehabilitation psychology. So again, so the only difference is in terms of the cadre or the rank that you'd be getting. So MPhil in rehabilitation psychology, it's again a 2-year program that you have to undergo. And here in this case, you would be again having a residency, and you would be also studying or having a hands-on training on psychiatry rehabilitation as well. You won't be only it won't be only limited with disability rehabilitation. It can also include, because some institutes include disability. Most institutes prominently include disability management, but some institutes would impart knowledge on other medical conditions like psychiatry rehabilitation, neurological rehabilitation, and things like that. So these are the primary courses that you can take up in the clinical field to work as a clinical professional or a practitioner, clinical practitioner in terms of mental health. So post that, there are some other courses also that is more like a super specialty course. Maybe I could give you a brief on that. So these courses are either named as a fellowship courses. So after your MPhil degrees, one can go for fellowship courses. So this is like more like a super specialty course. So these courses are primarily, right now it's available in an institute called NIMHANS in Bangalore. So NIMHANS offers these fellowship courses. So mostly they have fellowship courses in psychiatric rehabilitation, fellowship courses in clinical neuropsychology, and fellowship courses in neurological rehabilitation. And again, there are a couple of therapeutic fellowship courses as well. So these include fellowship courses in cognitive behavior therapy, and fellowship courses in pediatric psychiatry also. So these are the courses that has been presently offered by NIMHANS. So, and that is it when we consider the the course that one can do in order to become a clinician or a practitioner in terms of clinical psychology. So these are the courses one can take up. So I think I have covered pretty much in the area of clinical practice. So that when we come to clinical research, here it is not necessary that the person or the individual who is interested to get into clinical work with a clinical population, not necessarily they have to possess an MPhil degree, which is considered to be a clinical practitioner degree. So here they can possess any degree, but it has to be something relevant to psychology. But here, what you'd be mostly what you'd be doing is you'd be planning out research studies, and you'd be working on close with many academic departments. So these academic departments, mostly these academic departments would include psychiatry or clinical psychology or neurology, neurosurgery, cognitive neurology, geriatric psychiatry, community medicine, epidemiology. These are the related disciplines where one can work with a degree of psychology, where one can work as a clinical researcher. So if you consider the role, it would be mostly like how you'd be doing your research at the master's level. But these researchers are not something that you do it out of your pocket. These researchers are funded by the government. So first, if you're affiliated to an institute, so you would be putting up a proposal to the government or through the proper channel, either through your supervisor or the department head. So the government would fund the research, and then you take up the project, and then the normal stages of research like planning the study, doing some field work, data collection, and things like that. So this is how the area of clinical research goes about. And I think I pretty much covered everything on clinical psychology aspect and clinical research aspect. And also, to be honest, I wasn't much prepared with what to talk about. Rather, I expected a session that, more like a Q&A session. So I am just open to your questions. Maybe that would allow me to, answer your questions very more in a precise manner.
Yes, thank you, Charan. My God, there is so much to it. For us, it was just clinical psychology. So
Okay.
very insightful. So I would request my classmates, I mean, you can either unmute yourself one by one, or you can just put it up in the chat box. So anything for Shruthi and Charan? So both of you are classmates, right?
Yeah, we are
Okay.
classmates during our post-graduation.
Right, right. I think some people have already put some, Shruti, can you see some of the questions?
I think the first one is with respect to details on the aspect of teaching after MA and OB psychology. Yes, so if you would like to pursue teaching in the area of OB, then if you're planning to get into any of the colleges or universities, then you might also require a NET qualification. NET is called the National Eligibility Test. So this is basically a kind of eligibility that you will be allowed to work as a assistant professors in university. After that, yes, you can definitely choose your specialization in OB, and then you can start your career in that particular space.
Okay.
Yes, and I think we have one question on sports psychology. Yeah.
Okay.
To become a sports psychologist, should we select clinical or counseling?
Okay, maybe I could answer that. There is no definite path to become a sports psychologist when it comes to India. So what you can, the persons who are having their post-graduation in psychology can continue to work with settings. Usually a sports psychologist would work with some dedicated sports organization. So when it comes to India, it's called Sports Authority of India, SAI. Okay, so SAI usually opens up numerous positions for sports psychologists too, but you don't have to necessarily hold a degree in MPhil in clinical psychology or counseling psychology. It's just MSc or MA in psychology. So that would be suffice.
I mean, like even when we were doing our masters, Jain University did offer a sports psychology diploma course. So you can probably find out for a research on different other universities in India which offers any specific diploma, and then probably you can pursue that particular specialization.
Yeah, and what I also heard is Rajasthan University has a course in sports psychology too. So maybe you can check the prospectus of Rajasthan University program, PG programs.
I think there is somebody who's asking, are diploma courses full-time course or a distance education?
Dr. Anju, is it specifically related to clinical or?
Yes, so some courses you told no PG something.
Okay, professional diploma in clinical psychology and professional.
Yeah.
Okay, so I just want to clear this thing. So when it comes to clinical practice, all the available courses are not distance education or correspondence course, because when you're entering into a clinical practice, this particular, so you should be capable of delivering all those mental health services. So all these curriculums are designed in such a way that it requires a full-time residential training. There is no distance education or correspondence courses that are available when it comes to degrees which are relevant to clinical practice.
Okay. One more thing I didn't write. If we don't do these RCI courses, we can still work under the name of some psychiatrist in hospital as clinical psychologist, right?
Yeah, I want to clear that as well. Okay, so if you are holding a master's in psychology or clinical psychology, according to the RCI Act and according to the Mental Health Care Act 2017, you won't be eligible to call yourself as a clinical psychologist. So according to this act, Mental Health Care Act 2017, so it states that people who are having MA or MSc in psychology, applied psychology, clinical psychology, and some other related psychological disciplines, plus have done their 2 years of MPhil in a recognized RCI recognized institute and having a valid registration number. So it's called CRR number. So it's called Central Rehabilitation Register number. So this is your license number. So you should be possessing this. Then only you'd be considered as a clinical psychologist, be it anywhere you practice in India. These are the this is how things are.
Okay.
Just a follow-on question on that. Which colleges provide this either diploma or MPhil? Any in Bangalore? or Karnataka?
Okay. When it comes to the state of Karnataka, there is no institutes which are providing this professional diploma courses in clinical psychology as well as rehabilitation psychology. But MPhil programs are available throughout this state of Karnataka. If you take there is a national institute in Bangalore itself, NIMHANS, National Institute of Mental Health and Neuroscience, which offers a 2-year residential MPhil training program. And also there is another institute which comes under the direct purview of NIMHANS. So that is called DIMHANS, Dharwad Institute of Mental Health and Neurosciences. But not everyone could apply for DIMHANS, but anyone can apply for NIMHANS, because DIMHANS has a certain admission procedure or a selection procedure, because DIMHANS is considered as a state institute, which gives more weightage to the residents of the state. No one from, I'm from Tamil Nadu. I cannot apply in DIMHANS, though I clear the exams or though I crack the interview, things like that. I won't be considered eligible, because there is a lot of scrutinizing process that go way ahead before you attempt your exam itself. So at that point itself, person who are trying to apply from outside the state would be considered ineligible. So, and then after DIMHANS, there are a couple of private institutes also. So the private institutes are JSS Academy, Educational Academy, that's in Mysore. And there is Manipal as well. Manipal.
I think even Christ also offers MPhil, right?
Okay, so Christ, or the MPhil program that is being offered by Christ is not MPhil in clinical psychology. So that is a conventional MPhil program, which is for 1 year. So the MPhil in clinical psychology program is very different from any other MPhils that you are seeing throughout the country, or be it in any abroad countries. This particular MPhil program is designed to make, it's a professional degree, to be precise. It's a professional degree. It's just like how you do, how someone do their MBBS, MD, or BDS, or PharmB, or nursing, or architecture. So these are the professional degrees. So MPhil is also considered as a professional degree, because at the end of this course, you would be having a valid license with which you can practice throughout the India.
So Charan, you're saying with the MPhil from Christ, you can't practice. You're not considered qualified.
Because that is a MPhil program that is specifically for anyone who wants to get a ticket into the area of research and academics. So even though they give MPhil in clinical psychology, always what you have to check for is whether it is recognized by RCI.
And Christ is not recognized by RCI.
Yeah. If
So
it's not
the only university in Bangalore that offers is NIMHANS. That is recognized by RCI.
Yeah. Even but here NIMHANS is not recognized by RCI, because NIMHANS itself a different institute. Okay, but you can be eligible to apply for RCI license if you complete your course from NIMHANS. NIMHANS degrees are recognized by themselves, because
but you cannot apply if you do MPhil from Christ. You cannot apply for RCI license.
No.
Okay, but you can do further study if you choose to do PhD from.
Yeah. Okay, so if you choose to do PhD in clinical psychology, again, PhD degrees are not recognized as a practitioner degree.
What do you mean? Okay, but only if you do a Psych D, you're saying. If you're doing...
in India, only PsyD and MPhil and PDCP are the recognized practitioner courses.
Okay.
Either you can go for PsyD, which is a 1-year program, or you can go for MPhil, which is a 2 years program, or you can go for a PsyD, which usually lasts between 4 and 5 years.
Okay.
Charan, I have a doubt.
Yeah.
Suppose that I take up counseling psychology now, and about 4 or 5 years later on, after a certain duration of time, can I go back and do clinical psychology and PsyD and all that?
There is no such restrictions that, though you have established yourself in a different area, you can, anytime come back and do something which you're passionate about. There is no such restrictions on that. And
what my question is, can I go do PsyD with a counseling psychology degree?
Okay, so PsyD in counseling psychology degrees are not offered in India. So
no, I'm talking about clinical PsyD itself.
Okay.
Because I'm going to do counseling psychology now,
Okay.
can I go and do PsyD in clinical psychology later on? Or do I have to do another MA in clinical psychology in order to do PsyD?
I'm sorry, I didn't get your question right. Can you just
Okay.
repeat it? Yeah.
I'll repeat it again. Now, currently, I'm doing MA counseling psychology. I'm going to take up counseling psychology. After practicing for, say, about 5 or 6 years, should I, can I directly go do clinical psychology PsyD? Or do I have to redo an MA in clinical psychology before taking up PsyD?
Okay, so there is no such restriction. So you can be when it comes to masters, you can hold degrees that can be either specialized in general psychology or applied psychology or counseling or whatever it may be. For that reason, you would be considered eligible. But here, most of the government institutes won't recognize distant education programs. So that's the main thing that is that you have to be aware about when you apply for MPhil or MPhil in any government institutes. But there are still chances that private institutes would take you people who are having their courses done through distance education mode.
Okay, thank you. And also, they do accept a distance education abroad also, right?
So abroad, again, it comes to the university of your choice. So abroad, I'm not sure how's the selection and everything. So I would rather recommend you to get into in touch with the admissions office there. So they would be able to help you better in this case. I'm sorry, Vasudha.
It's okay. It's okay. It's okay. My first question is answered more than enough. Thank you.
Okay.
Yeah, I think some of our classmates had put down a list of questions. So, Shruti, can you see in the chat box, all the collated questions? If we can, if we can take it up quickly.
I think I can see it here.
Yeah. So, would you like to read it
I think
out?
a few of them. There's one question on. Yeah, I think there's one question on. If in case you're required to take if you're interested in research, is there any elective? I think research is open for any specialization, whichever that is your area of interest that you would like to pursue. You can choose that particular area, be it clinical psychology, counseling, or forensic psychology, or sports psychology. Anything. It's completely dependent on your choice of research. Yeah, and then there are 2 questions with respect to what is the difference between HR and OB, and a few insights on corporate training. Yes, major difference between HR and OB. I think HR comes along with a tinge of business management. Okay, so you will definitely have papers with respect to the business management part of it. Okay, where you'll be learning a little bit about the operations part of HR, which includes your compensation, your compliance, your labor laws, and a little bit of business oriented. Whereas organizational behavior is completely into psychology. So psychology of workplace. So that is what does employees you talk about employees emotional intelligence, you talk about the organizational culture, then you talk about leadership, then you talk about groups and team management. So those kind of things which is more closely related to human behavior fall under the purview of organizational behavior. Yeah. And coming to the question on corporate training, yes, corporate training, I think, yes, it's a very good, it's a very very well established field in the area of organizational behavior, I would say. If you wish to take up the role of as a corporate trainer, then you can, especially if you club the organizational development and corporate training, I think that is a very good way to integrate both, because you will be focusing more on the the overall organizational development part of it. That is when it comes to how do you enhance the processes here, how do you make it more employee centric, and also you can focus on a lot of behavioral skills training. That is these behavioral skills, especially, it might not really have a very a business impact or a return on investment at the very short term. But in longer term, again, as we say in counseling or in clinical, it is completely individual oriented. So in that case, you can definitely bring in a lot of interventions and try out different behavioral approaches towards in as a part of corporate training. All right. And I think a few areas, to become a corporate trainer, you need to start working in the area of learning and development. Okay, where you first begin with how do you can probably begin with smaller, focusing on smaller soft skills like communication, team management, and things like that, and then later move on to how do you design a content. Then how do you what are the different ways what are the different methods of research that you need to follow to design a content? What is your target audience and how do you cater your content to them? So these things are the first kind of baby steps for becoming a corporate trainer. And definitely communication is one very big aspect to it. You need to be confident, and the fear of stage fear or even public speaking is one very good quality that will make you a corporate trainer. Apart from that, if you kind of focus on these particular aspects, you should be able to establish yourself in that particular field.
So Shruti, I just want to thank you for answering this question. And also, is there any specific training that we need to take up other than, like if you're doing masters in psychology, like second year taking OB as the elective. So if I have to do a corporate training, like getting into corporate world, so is there any other learning and development you told? So will it be part of the HR where we'll be working with them, understanding, or any other certifications are required to even get into it?
Yes. To start off with, as I said, if you focus on learning and development related certifications, there are very beautiful ones which are available on AIHR. If you check out these websites, AIHR and then SHRM, it's a little costly, but I would say it's very, very effective because it comes along with it's also affiliated with all international universities as well. So if we take up those courses and then get into the space of corporate training, I think it would add a lot of value to it. And also corporate training, there's also another course on train the trainer. So this is the TTT course we call it. So this is one course that most of the corporate trainers initially start off, taking as one of their major certifications, I would say. If you also have this on your, palette, I think it's well good to go ahead with.
Thank you. And one more question, Shruti, last question. Is it mandatory to have any kind of HR background to work in OP?
Absolutely not, because I come completely from a psychology background. I did my undergrad in psychology. I did my master's in psychology. But if you're going to take OB in your specialization, then you will definitely have 1 or 2 papers on human resources management as well.
Okay. Thank you so much for all the beautiful insights.
No worries. I think next question, Charan, it's for you. One is on this: are these MPhil and PDCP courses residential courses? Like, is it being offered in colleges?
Okay, 1 second. Of course, these MPhil and PDCP or PDRP or MPhil and rehabilitation psychology, for that matter, this is a residential full-time courses, and the candidates who are enrolling for these courses has to be present throughout the whole training program, that is for 2 years.
Okay, Sharon, can I ask you one question?
Yes, ma'am.
To call yourself a psychologist, just a PG is not enough. You need to do an MPhil or this PDCP or PDRP is what you're telling me. Just we cannot call ourselves a psychologist after this MA psychology.
Okay, so I'll explain you that question. So you cannot call yourself as a clinical psychologist, and if you don't have a valid Rehabilitation Council of India license. So that's the main thing for clinical psychology. But for psychologist, for you to call yourself as a psychologist or use the title psychologist, there is no such regulations that has been amended by the government for now. But I would also recommend you to check on this act that has been passed in the year 2021 presently. So it's the act called Allied and Healthcare Professionals Act 2021. So which defines all these Allied and Healthcare Professionals Act. So, and there is a domain of psychologists. So this particular domain is called behavioral health professionals. So in behavioral health professionals, there are set of allied psychological discipline professionals would come in. So there would be they can where they recognize the titles of psychologist, counselors, therapist, dance movement therapist, and CBT practitioner, ABA practitioner, and things like that. So, and they have passed the act, and they have passed the bill, and now it has become an act, but there is no it has not come into a fruition for now. They have set up a national commission for that, and there is work in progress. So once that is done, then there is a proper regulation that who can call themselves as a psychologist or any other allied behavioral health professional. So there's a regulation that would be coming up. For now, there is no such no one is legally bound, or no one is legally responsible, even if they call themselves as a psychologist.
Okay, because I think even in the Allied Healthcare Professional Act,
Yeah.
IGNOU psychology is not recognized as.
Okay, so yeah, that's the point. So
and
here,
another question,
because they have not. I think they have mentioned that people who have done their masters full time can be recognized as a psychologist, but not the people who have done their masters through any distance education or through correspondence mode. But these things are it's not it would change from time to time. So we are hoping to get you guys also inducted into that particular disciplines, and I would not consider you guys as a not being a not equivalent to a professional. Like you guys have have been studied for 2 years, 2 years duration, and you guys are considered to be a professional as well. But let's be optimistic about that.
So does it really specify about this? I mean, I was given to believe that IGNOU MA would be recognized, and if you have to practice as a counselor or a CBT therapist or any kind of other healthcare professional, so this particular act does give us permission to kind of, and that I think that is the reason why majority of us are doing MA psychology from IGNOU.
Okay.
So, but because IGNOU, again, being a national university compared to the other open universities or this thing, it would have been recognized. But I don't know if this act, does it specify that IGNOU is not recognized?
Okay.
It doesn't come under the list. There are people who are trying to get it recognized. There is some movement going in the team.
There are active efforts and initiatives that has been taken by people throughout the country. And we are just hoping that, you guys could also join us. And to answer your question, Ms. Julie, and right now the act did not specify who is a psychologist or who is the CBT practitioner or who is the behavioral analyst. It does not come up with qualification by far. But since there is a work in the progress, so once they set up all these national commissions and state-wise commissions, because this act specifically talks about there would be a one national body, and there for each state there would be some state licensing authorities as well. So first they have to set up those things, then only they would focus on what is the qualification of a psychologist, or what is the qualification of a behavioral analyst, or what is the qualification of a CBT therapist. So right now there is an argument and there is a discussion that is going on that people who have done MA in psychology or MSc in psychology through distance mode or correspondence mode won't be considered. So there is this argument that has been going on. So that's what I presented in front of you, but I'm not sure. I'm just waiting for the final guidelines that has been sent across.
Okay, one more.
Charan and Shruthi, I would want to know one thing from you. What exactly do you do? Like Shruthi, for example, in the organization, okay, you've given us some things, but what all was your task? What exactly did you do at a practical level? And same for Charan, I want to know, like in your MPhil, because the other day you were sharing some of those interesting assessments, and what you studied in MA was actually very different than, of what you do right now. So your practical experience so far, if you can share a few ideas.
Yes, so my role in my current organization is I work as an HR executive. Yeah, one more thing which I also like to add here is there are very few corporates which will give you the designation as an organizational psychologist. Okay, that also you could be a little mindful of. I mean, I would specifically would like to be referred as an organizational psychologist, but most of the corporates, since you work in the human resources department, they prefer to go according to their own hierarchy. Yeah. So in the area of human resources or OB, my day-to-day activities include learning and development, where I design the policy for learning and development and related initiatives in the organization. I execute it, and as well as I make the framework for how do I recognize and reward these learning achievements. How do I make the process of learning more engaging as well as fun? Okay, and another area of my role is in enhancing employee experience and engagement. So here it is not just restricted to conducting a Diwali event or a Christmas event, which is the common stereotype of any HR, I would say. But we also carry out a lot of surveys. We do personality assessments because I got to work under an organizational psychologist. I had the privilege or even the space to administer a lot of personality tests. So when it comes to personality tests, I mean the psychometric assessments, which is used in a lot of corporates, like a DISC assessment or even 15 FQ plus assessment or 16 PF. These are personality insights which will help understand your employees in depth. I know it will address their emotional needs, their their motives, their traits, and help you shape your engagement activities or the kind of experiences that you would like to add to them a little more in very employee centric way. Okay, and another area where I manage is in terms of, it's called HRBP Connect, Human Resources Business Partner Connect, where I also be part of a lot of the interdepartmental vertical discussions. If in case there is any kind of a process challenge or a roadblock that people usually hit, then we try to kind of simplify it. We identify what are the different collaboration challenges that are happening, redesigning the team, or redesigning the reporting structure. These are things that also is part of my job. And another area, I was also part of recruitment, but then I really didn't like that domain, like because it's a little, it's more, you need to have a lot of tolerance, I would say, for recruitment, because candidates come, reject, they don't take your offer. There's a lot of renege that happens. So yes, I mean, it will not be it's very unpredictable, I would say. At least human behavior has become predictable to some extent these days. Yeah. So that is also a part of my day-to-day engagement. Yes, and one interesting way, I mean, where a lot of psychology is involved is, planning on these employee well-being initiatives, and also the psychometric assessment part, because especially the people who come with a Master of Business, MBA degree in HR, they will not have this privilege because they're not trained. They're not a trained psychometric assessor. Yeah, only a psychologist is a trained psychometric assessor, and you will be taught how to administer and also interpret these reports. So, which I think is an add-on for you. Yeah, I think Charan
right, Shruti. No, another sorry, one last thing. So, when they are emotionally down and out, these employees, do you also pitch in to counsel them one-on-one, or how does that go? What kind of counseling, I mean, happens in an organization, if you can give some idea on that?
Yeah, okay. Seema, that's a very nice question that I would like to answer. But to be very honest and to give a very realistic perspective to it, organizational, when it comes to the employee counseling, they don't actually consider OB psychologist, to be placed in that particular area, but rather a counselor, a counseling psychologist would get an opportunity in that particular space. As I said, since we do not, especially in OB, we do not learn about any specific therapies. Okay, so if you're really interested in specializing any of these therapies, like mostly the kind of therapies that is applicable in workplace is your REBT, rational emotive behavior therapy, and also your CBT also works. Okay, so and also mindfulness based therapy. So these therapies are very commonly used at workplace also. But if you're interested in this, exploring this particular space of human resources functioning, then I would recommend you taking up a specific course or a certification in any one of the therapies that you're interested in. And then probably, you can go tell your employer saying, see, I know this, I will only do it. Why do you have to invest on another counselor for that matter? Yeah.
Thank you, Shruti. And Charan.
Thank you, Shruti. One question, Seema. In related to whatever Shruti was sharing, Shruti, if you want to talk about, I mean, you are aligned to HR functions or L&D?
I'm aligned to more of L&D functions. L&D and
functions.
employee engagement and experience. Yeah.
All right. Thank you so much.
Yeah. Yes, Charan, I think over to you.
Thank you. So my day usually throughout the week would start on the surface level. My day would be something to do with something called psychodiagnostics and psychotherapeutics. So that's the job role that has been assigned to us. So psychodiagnostics, as in we would be using some set of standardized psychological tools or any other related tools that we use to diagnose people who are having any sort of mental illness or any psychological condition. So I think I started this course 5 months before. I think from Jan I've started this course. So far I've been posted in the child and adolescent psychiatric unit. So over there usually my role would be like there would be patients coming in. So first thing what I would be doing is I'd be planning out the psychodiagnostics. So psychodiagnostics, as in first we would usually go with case history and MSc first. We take in the symptoms and we'll see what's their mental status examination. And based on that, let's say we have a patient who was a suspected intellectual disability or mental retardation. So in that case, the psychodiagnostic, the process would be going for an intellectual assessment or an IQ assessment. Or let's say, because I'm posted in child and adolescent psychiatry, so these would be the case that I'd be mostly seeing. So I'd be seeing cases like children with mental retardation, children with autism spectrum disorder, children with some personality problems, children with some addiction problems, and children with specific learning disorders or specific learning disabilities, things like dyscalculia, dysgraphia, dyslexia. Now, these are the cases that I primarily deal with. So on the basis of that case, let's say I'm having a person who's suspected based on the case history and MSc, I am clinically judging that person has a specific learning disorder. So now I have to go ahead with something called as a psychodiagnostics. So psychodiagnostics is anything like what you see with all these MD pathology doctors would do. So usually when you walk in for a consultation and when you have a viral fever or something, your doctor would suggest you to go for a test. Okay, so in test, the doctor who is a pathologist who's having an MD in pathology would take in some blood sample or salivary samples, and they would do some testing, and they would give you the report whether you have some particular problem or not. So the same thing has been translated here. So here in psychodiagnostics, we are the appropriate word that we could use is something called as a psychopathologist. So we take in the patient, we run some sort of test to arrive at a diagnosis. So that's what. So to give a so as with the case of SLD, we would be using something called as a NIMHANS SLD battery. So it's like some set of tests that we'd be conducting on the patient, and with the results what we are getting, we'd be coming to a diagnosis. So once this particular diagnosis is arrived, how are we going to manage this particular patient? So that's where the psychotherapeutics comes into the picture. So since there is not much of a scope for psychotherapeutics in terms of child and adolescent psychiatry, we won't use it that much. But but there are some skills that we can teach the patient so that it could able to function. It could help them to enhance that particular functioning. Let's say the child is lacking in reading skills because he has dyslexia, or let's say the child is having some poor handwriting issues because he has dysgraphia. So what we can do is we can start in with something called as a remediation program. So when it comes to mental health, we won't be the person who would be dealing with all these things. So it's mental health is all about a team approach. Here, what we would do is, here we would be diagnosing the person with specific learning disorder. So when you ask me what about the treatment or a therapy those aspects. So here what we would do is we would refer that particular patient to this particular department, that is speech and language pathology. So because speech and language pathologists are trained experts in dealing these kind of cases, but they are not trained experts in diagnosis these cases. Okay, so these are some intricacies that exist in terms of clinical psychology. And also there could be I'm just talking about from child and adolescent psychiatry perspective, there could be some disorders that could mimic, or that could mimic a different disorder also, but it won't be very apparent. So that also during that cases there would use a lot of psychometry again. So the psychometry or psychodiagnostic procedures again and again in order to arrive at a very valid clinical diagnosis. But we won't, if we have any sense of clinical suspiciousness, that by looking at the patient itself, you can get to understand, okay, what this case is. But when you do the psychodiagnostics, it could be something else. Okay, at that point itself, you feel that there is a sense of there is some clinical suspiciousness and there is some contradicting evidence. Okay, in that cases, we need to run more tests in order to get an empirical finding so that we can give the diagnosis. So that's all with psychodiagnostics. And talking about the psychotherapeutic perspectives, it is more applicable to an adult psychiatry or geriatric psychiatric populations, because we cannot start in CBT with a child. That won't work out. Okay, or for any other therapy for that matter, REBT or anything for that matter. But another therapeutic approach that we follow is something called as a biofeedback approach that we use very prominent in terms of child and adolescent psychiatry units. So why we are using this is specifically for autism spectrum disorder population. So autism spectrum disorder population would have a variety of symptoms. So usually they would have some behavioral problems and they would have some serious sensory issues. They would be really they can be really disturbed by a minute sound that is present in the environment, that could result in a very aggressive behaviors also. So in these kind of things, what we use something called as a biofeedback therapy, and also what we use as something called as a avoidance therapy or aversion therapy as well. So these kind of therapies would help the patient to how to manage or how to mitigate those behaviors that are considered to be problematic. So that's pretty much it in my experience. So I'd be moved to the next unit in the upcoming months. So I'd be moved to a psychiatry unit, and I don't have much of an exposure there. So I feel that I am kind of little naive in terms of psychiatry. It's actual psychiatry. I mean the normal adult psychiatry and geriatric psychiatry population. So due to that, I feel that I don't have much information to talk on that. So so far what I covered is basically what I do on my everyday basis during my posting.
Right, Charan, where does the doctor come in?
Sorry, Seema.
Yes.
No, I was just asking Charan.
His MPhil form.
Yeah, where are you doing it from?
Okay, so I am doing my MPhil from National Institute for Empowerment of Persons with Multiple Disabilities, or shortly called as NIPMED, in Chennai.
In Chennai, okay.
Yeah, in Chennai.
And they take, of course, you done your MA from IGNOU, right?
No. I did my MSc from Jain University, Bangalore.
Okay, okay.
Yeah.
So what our understanding is that with an MA from distance, MA from IGNOU, our options for MPhil are very limited. I hear that NIMHAS doesn't take.
Yeah.
So do you know what institutions will take us with an for an MPhil after having done a distance? Do you know which universities will take us?
Okay, so I don't have a precise answer to this, but what I heard is most of the government institutes or central government and state government institutes won't take in people who have done their post-graduation through a distance mode. But there are scopes and there are chances for people who have done their through these modes in private universities. private universities like Amity, JSS, Manipal. So these people would take in people who have done their masters through distance mode. But if we talk about the remuneration and stuff, so usually during the MPhil coursework, we all would get stipend because we're not learning. It's actually we are practicing it. Okay, so if we go by the rank level, this posting would considered as a anyone who has done their MBBS coursework, and after MBBS coursework, there would be a mandatory 1-year internship practice, right? So that practice, that particular thing is called a CRRI program, or they would be also considered as a junior doctors as well. So this rank is equivalent to that. So we would be also getting paid because due to the work nature and the work that we are putting with the patients. So, but when it comes to the private universities, the one demerit that I would say is it would the tuition fee itself, it would cost you a bomb. Okay, the tuition fee. On top of that, there won't be any stipends or there won't be any remunerations per se.
And how many? Not all of them are RCI recognized either. I hear Amity is, but I don't know about the others.
Yeah, Amity is RCI recognized, JSS is RCI recognized, and Manipal is also RCI recognized.
Okay, and they all offer MPhils.
They all offer MPhil, but the scope for if you're holding a degree in MA or MSc psychology through distance or correspondence mode, the scope would be higher if you apply for private universities than government institute, because government institute has this rigid rules that they won't take in people who have done their masters through these modalities.
Okay, I have one last question. What about the UGC JRF exam or the UGC NET exam? Does that increase our chances of getting into any
Okay, so though if you have cleared your UGC NET lectureship or JRF research fellowship, it does not significantly improve your chances of getting selected when it comes to the national and state institutes. But you might still have a chance with the private universities.
Okay.
And also, if someone is interested in research and stuff, IIT has come up with this competitive exam, just like UGC NET and JRF. They have come up with this exam called GATE. GATE is mainly for engineering. So of late they have come up with GATE in psychology. So if you clear GATE in psychology, you can get into a PhD program in any of the IITs that is offering PhD in psychology. And also even that if you're doing a PhD in IIT, you would be also getting stipends also.
And RCI recognition also.
No, it is a research program. It is not a clinical practitioner course.
Okay, RCI is only for applying it's applied. It's not research at all.
Yeah, no, RCI. If I have to address that question, if you do an RCI recognized degree in clinical psychology, you can practice as a clinical psychologist. You would be having the license to practice. And it's again a dual role. You can be a researcher also.
Okay, I understand. Okay.
Yeah.
Thank you.
No problem.
Right, I think
Seema.
Yeah, I think we are already
yeah, I know we are
crossed around 15 minutes. So yeah, we'll wind up. Yeah, go ahead, Shalini.
Yeah, Charan, my question is, see, I actually work with children with SLT, so I can do educational assessments for them. But for the IQ, I normally send the children to a psychologist. So if I
clinical
do
psychology,
will I be able to do it for my students?
Okay. So regarding all these because IQ is considered as a psychodiagnostic testing, IQ testing or intellectual functioning testing would be considered as a psychodiagnostic testing. So this has to be done by a qualified clinical psychologist, not by any other person who's having a background in psychology and also know the intricacies of IQ assessments and stuff. They won't be recognized because if you go through the RCI Act, it has clearly mentioned that these are the functions, these are the primary functions of clinical psychologists, also rehabilitation psychologist as well.
Okay, thank you.
Right. I think that was extremely insightful. Thank you so much, Charan and Shruthi. I think it was one of the best decisions to call you both on board. And I think, yeah, we're getting some direction. So on behalf of my classmates, I would really, really thank you for taking out time. You didn't really have to do this, but I really thank you. Right?
No problem.
So, all right.
And yeah, one more thing, if at all, if anyone is having some further queries or stuff, maybe you can reach out to my LinkedIn. I'd be happy to answer your queries as well. I will put a link in the chat box.
Oh, nice. That's good. Awesome.
Thank you.
Same goes for Shruti, I think.
Yeah. Probably, but after I probably update my profile.
All right. Okay, then. Thanks a lot once again.
Thank you so much.
Right. Bye-bye.
Everyone. Yeah.
Thanks a lot, both of you. It was really insightful. Thank you.
Thank you.
Thank you so much, all. Thank you so much for calling us. And I'm like very delighted by this opportunity. Thanks once again.
I know you took the class for us, but being an elder to you, we should say all the best for your future, your careers. And we are very glad that you seem to be right on the right track and doing a very great job.
That's right. Absolutely.
Thank you. Thank you so much, Ms. Shalini.
Right. Okay. Bye-bye. Take care. Good night.
You too all.
Seema as well. Thank you so much.
Thank you. Thank you. Bye-bye.
Bye.